So what are the different rehabilitation protocols falling under implant dentistry? For completely edentulous jaws, that means if you have no teeth at all, you have an All-on-4 and All-on-6. What does All-on-4 and All-on-6 mean? You have 4 implants in the upper jaw, 4 implants in the lower jaw, or 6 and 6 in the lower jaw over where your entire teeth are based. You have an All-on-10. You also have something which are, suppose if you have very small amount of width of bone, then you have something going and anchoring all the way up to your pterygoids. So they are called as your zygomatics or your transnasal implants or pterygoid implants. And what if you do not have sufficient bone to anchor implants at all? Sometimes you can also have the small tiny bit of implants with attachments which are called as overdentures, implant supported overdentures. For smaller phases where you do not have multiple teeth missing, you can also have fixed dental prosthesis or fixed partial dentures to rehabilitate your smiles.